Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. All right, another round of penis questions. These are going to be related more to uncircumcised anatomy as well as some sensitivity questions. Okay, question number 1. Why am I so self-conscious about being uncircumcised? So if any of your fellow uncircumcised folks are watching, please shout out some supportive comments in the show comments, okay? Being uncircumcised is totally healthy. It's actually more common worldwide to be uncircumcised than circumcised. It's the way you were born, nothing to be ashamed of. So that would be my first comment. But I suspect that you are in a society, like the United States, where circumcision is portrayed more positively in social media or in the porn industry. But penises are pretty much the same when erect. They function the same. They look the same. You pee the same. You ejaculate the same. So there's really nothing to feel bad about. Having a foreskin is the way you were born, and it's perfectly fine, perfectly normal. In fact, you'll probably also see some comments to this video, but there's a lot of research that supports increased sensation, increased sexual pleasure when having a foreskin. So I hope this helps. You have nothing to feel self-conscious about. Uncircumcised penises are healthy penises. Question number 2. My girlfriend has quite long nails and sometimes strokes the tip of my penis, and it feels extremely sensitive but slightly painful afterwards. Is this okay? So yeah, a little brief pain is fine. If you don't like it, you can tell her. I would say the one issue might arise if you get a cut on your penis, in which case I would recommend putting on some topical antibiotic ointment that you could get at a drugstore. But otherwise, it's not going to be necessarily harmful, but undesirable. So just talk to her. All right, question number 3. I'm only 14, but I have a lot of these little dots on my foreskin, around the tip, and on the shaft too. Okay. This could be a variety of things, depending on what you're looking at. So something called Fortis spots are little sweat glands underneath the skin, and they are very common on the shaft, on the foreskin, on the testicles, and totally normal. They almost look like sort of little whiteheads or little pimples, but they are healthy, absolutely fine. They may get better with time, and they may not, but they're super common. Around the head could be something called pearly penile papules, which actually look more like little fluid-filled cysts around the glands or the head of the penis. Also super benign, nothing to worry about, totally healthy and normal. They may or may not go away with time. Don't try to pop either of these. It can actually scar or lead to infection or make things worse. If down the road you're feeling bad about the pearly penile papules, dermatologists can do some things for you, but there's nothing wrong with them. Totally healthy and normal. Question number 4. Is it normal when I touch the head of my penis that it hurts a lot? The main problem is that it hurts when I touch it without the foreskin there. Is it normal? So this can happen with an uncircumcised penis. I will say normal for it to be extremely sensitive and hurt, not necessarily, but it's pretty common, and there are things that you can do about it. So if you go to a drugstore, you can find topical lidocaine, which is basically like a numbing medicine. And that can prepare you for either your own sexual pleasure, or if you're being intimate with a partner, you can apply this to the top of the penis, the head of the penis, 10-15 minutes before you have your act, and then wipe it off before you are, especially if you're with a partner, wipe it off beforehand, because that will then reduce sensation for them. But it's okay. It's nothing to be worried about necessarily. The head of the penis can be more sensitive for those who are uncircumcised, but it's also very manageable, and you shouldn't have to suffer with pain. Sensitive, normal. Pain, you don't have to deal with it. Alright, question number 5. Is it okay for me to keep my foreskin retracted behind the head at all times? Are there any bad things about this other than losing sensitivity of the head? So, baseline, no. Like, there's nothing wrong with keeping your foreskin retracted or above the head of the penis. That being said, the thing we worry about with foreskin being retracted long periods of time is if it's something called strangulated. So if it's super tight and you can't get it over the head. So if it's so tight that it's cutting off circulation to the head of the penis, that's actually an emergency. But if you're just casually pulling back the foreskin, that's okay. There's nothing wrong with that. Just make sure it's not so tight that it's cutting off circulation to the head of the penis. That's bad. That's bad. Okay, and that'll do it for this round of penis questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.